Hi, my name is Dr. Abie Mendelsohn. Thank you for finding my YouTube channel. Today we're going to talk about all the different aspects of Davinci Robotic surgery. So what we have today is the newest model is the XI Davinci Robotic System. The XI system has really three main components to it. There is the surgeon's console, where I would sit. There is the bedside table, and that's the only part that's actually going to be touching the patient. And then there's also the video console, which is the tower that shows everybody else in the room, has all the power supply, and really kind of the brains of the operation, so to speak. Let's first start with the surgeon console. Surgeon console looks like the most intricate video game system where the surgeon would start by putting their forehead against the cushion. Within that system, once the forehead is up against it, you have two viewports that actually combine to give a 3D-like view. So we get a depth perception because there are two separate eyepieces, just like any good 3D movie. That's the visualization. Our elbows go on a small pad just in front of us so that all the weight comes off our shoulders. We can sit there for actually a lot longer comfortably than a standard traditional surgery. And our fingertips will go into small controllers that are just in front of that elbow pad. Those controllers are the direct manipulation, so to speak, of those surgical instruments that'll be touching the patients. There is nothing that happens without the surgeon's direct instructions. There's no automation. This is something that allows for miniaturization of our hands. It allows for things like wrist rotation, so it can turn the robotic wrist 720 degrees, but obviously a human wrist can't turn that many times over and over. So what we have is human control, but enhancing our physical limitations. Things like tremor reduction. So if there's too much coffee having been drunk that morning, that tremor reduction can be applied to those surgical controls. Underneath the surgical controls at the surgeon's console is going to be all the foot pedals. The foot pedals have control of the camera system, so we can move and target where we're looking at a consistent basis. In fact, the more that a surgeon will make small changes in where the camera is positioned, the better the surgery has been shown to be. So that's something that is of frequent use. There is also the energy, meaning bovie or bipolar, the way that we coagulate, the way that we cut safely and bloodless, and really making sure that we control the blood loss is a critical component of the surgery. There's also going to be additional instrumentation that can be brought into the robotic system, things like clips, surgical clips, harmonic vessel sealers. Those are also going to be controlled and activated by those foot pedals on the bottom. Lastly, there's a side foot pedal, which allows for an activation of a third surgical arm. We always say, wish we had another arm. Well, actually the robot has 3 arms in addition to the camera arm. So there is a side foot pedal along the number of options below to activate or switch between the second and third arm in terms of which one you are currently using. So that is a surgeon's console. Then we move over to the patient console, and that has the cannulas, meaning the holders for the different surgical instruments, and the endoscope. The endoscopes generally come in either a straight view or an angled view. The angled is 30 degrees, and that can be angled up or down, and again turned with control at the surgeon's console. We have then all the different instrument ports, and those instrument ports can be exchanged depending on the needs of the surgery. Generally speaking, there is a grasper of some sort, there is a cautery device of some sort, that's standard, but again, there is a literal menu of different surgical instruments that is required depending on what's trying to be achieved during that surgery. That is positioned in place either through different ports depending on the body cavity, or in my situation, we generally will try to fit all of those through the mouth, which can be done very successfully. Those all then get subsequently connected to the vision tower that has the power generator. That is what the link up is to the surgeon's console. And then there we go, the surgery gets going.